All right, so what do you need to know to help keep you and your family safe from the H1N1 flu?
The director of the La Crosse County Health Department, Doug Morman, joins us now live here to talk a little bit more about this. Thanks for being here with us tonight, Doug. First of all, those 10 deaths, can you put that in perspective for us? We don't want to alarm people with this late news of this latest death.
Certainly any death is not good, but the 10 is a relatively low number. Here in La Crosse County, we have about 15 deaths each year from seasonal influenza. So we're comparing a statewide number to a just La Crosse situation. That does not mean that it's not serious, but it is not. But it is something that we will be able to keep ahead of.
All right, Doug, so in the case of this young girl, 2-year-old Aubriana, who passed away so suddenly, some people might wonder, is there a real difference in the symptoms between seasonal flu and H1N1 so you can tell the difference?
Well, frankly, they're very similar. What is different is that H1N1 tends to affect a younger population more than an older population. The average age for a person being ill enough to have to go to the hospital in Wisconsin is about age 13. So it does tend to affect younger people more than it does older folks.
And now you're seeing some changes as far as working with schools now and so forth?
Yes, we're working closely with the schools. They're reporting to us each week what the level of illness is. We're working with them to be sure that we can help them figure out ways to keep kids as healthy as they can be. We're in the process now of planning for the distribution of the H1N1 influenza vaccine when it becomes available in the next few weeks.
Okay, and a lot of people, it's new news to them that it's actually not just a single vaccine for the H1N1.
That's correct. For some populations, and especially the younger population, it's really a 2-shot series. So a child, for example, a 6-year-old child would get a shot, and then between 21 days and 4 weeks later should get the second shot. Older populations don't need that second booster shot, so it's going to vary a little bit by the type of person that's getting the immunization.
All right. Thanks very much. Doug Morman joining us live tonight. Thanks.